Good evening, everyone. I'm Curie Ahn, a nephrologist from Korea. The topic of my presentation today is gain insight to increase the number of deceased donors through Korea's experience. I would like to thank you for the opportunity to discuss this issue again with Vietnam National Coordinating Center for Human Organ Transplantation and the organ transplantation experts in Vietnam I have met before COVID-19. I have nothing to disclose, but I am working with these listed organizations in transplantation. I will divide my presentation into 7 parts listed here. In Korea, the organ transplantation program started in 1969 with a living donor kidney transplantation, which was followed by the first deceased donor kidney transplantation in 1979. The number of organ transplantation increased continuously in Korea, and more than 4,000 transplantation was performed in 2020. Among those, 33% were from deceased donors. Most of the transplanted patients have enjoyed not only healthy, good quality of life, but also economic benefit of organ transplantation, since the average cost of KT per each patient at third post-transplant year is just 1/3 of that of a dialysis patient. However, waiting list and waiting time grows longer and longer, and death cases while waiting reached up to 5.8 patients per day. And this number of people filled up the Opera Theater of Seoul Art Center is dying each year while waiting. This situation has driven devastated patients into seeking illegal ways for organ transplantation. At the beginning, illegal organ transplantation started from a personal interaction between donors and recipients. And nowadays, those patients seek opportunities for overseas transplantation through web-based black markets. Since such an unethical problem occurred all over the world, TTS, ISN, and the WHO announced the Declaration of Istanbul, which was updated with 11 items in 2018. And the core provisions of Declaration of Istanbul are protection from organ selling, stop organ trading, and establishing the national self-sufficiency. National self-sufficiency is the essential condition for ethical organ transplantation. For achieving national self-sufficiency, the Madrid Resolution was presented in 2010. 3 main categories of national responsibilities for self-sufficiency by these resolutions are increasing organ availability, ensuring fairness, justice, and transparency, and preventing the need for transplantation. To reach this goal, each nation is needed to establish operational and regulatory structures under the legislative framework that is coincide with ethical principle of Declaration of Istanbul and WHO guidelines. Korea adopted the organ transplantation law in 1999, and there were many hospitals with organ transplantation centers. In the other words, from 1991 to 1999, brain death organ transplantation were carried out without legal background or a national regulatory body. This table shows a list on what each country's organ transplantation law and regulation should cover. As you see, a national organ transplantation law must include at the very least 6 items listed here. The organ transplantation law approved in 1999 included 3 out of 6 previously shown items, and those were definition of brain death, prohibition of organ trafficking, and establishment of national transplantation organization, and Korea took opt-in system for the basis of consent in diseased organ donation because Korea has been a family-oriented society. Based on this law, National Transplantation Organization was established as a national authority to oversight standards, practice, and performance, to provide criteria and guidelines, and to certify or authorize transplantation-related process and organizations. This Korean National Authority was named as the Korean Network for Organ Sharing, KONOS. The KONOS has been responsible for managing the waiting list, allocating organ procured from deceased donors, addressing coordination and policy implementation, and playing a major role in regulation and evaluation of all the organ transplantation activities. When KONOS implemented highly strict regulatory surveillance for every transplantation process, the number of deceased organ donors decreased sharply because hospitals stopped organ procurement for fear of something would go wrong. This event resulted in a reciprocal increase in cases of overseas organ transplantation, and the main destination country for these unethical transplantation activities were China. Faced with this terrifying situation, Korea hastily had to activate this organ transplantation. When we carefully reviewed the WHO requirements again, we found that we needed to develop an efficient and principled organ procurement organization, OPO, and the transplantation database. In this context, we revised the organ transplantation law in 2010 to insert additional articles on the establishment of OPO, on adaptation of mandatory reporting of potential brain death donors, and to establishment of a national transplantation registry. And we put our effort to the most immediate task of establishing an OPO, firstly to maximize organ donation from deceased donors through developing and maintaining highly qualified organ procurement professionals, and through providing adequate education for OPO professionals, and secondly, to provide national guidelines for organ donation and procurement process. By this time, leading hospitals had developed programs for organ procurement from deceased donors in the department or the centers. We call this type of organ procurement program a hospital-based organ procurement organization, HOPO. However, we concluded that we were to build a national independent OPO, IOPO, because in comparison to HOPO, IOPO can activate the organ procurement process in non-HOPO hospitals. IOPO can maximize the use of donated organs. The standardized process can be adapted easily in IOPO, and it can cooperate with tissues and eye donation using a national network. Thus, the government agency, the Korean Organ Donation Agency (KODA), was established in 2009 to perform and support deceased donor identification, deceased donor management, deceased organ donation process, and post-donation care, and you will hear about KODA from our next speaker in detail. Although the incidence of brain death events was much higher in hospitals, many health professionals were reluctant to discuss about deceased organ donation with their family members. The most common reason for the reluctance was that doctors were afraid of facing any risk of conflict with family members. Next common cause was a lack of knowledge on deceased organ donation, since only 32% had received any education about deceased organ donation by then. To overcome the low reporting rate of around 15%, we implemented the mandated reporting of potential deceased donors in major hospital units such as ERs and ICUs. The basis for this act was Article 17 of the amended organ transplantation law, which stated that the head of the medical institution that diagnosed the person presumed to be brain dead should notify the head of OPO. Even with medical professionals must report deceased donor candidate to KODA because of the mandatory reporting law, it is not easy to make a final decision for organ donation for the family members when one of them was diagnosed as a brain dead in a hospital, since most of these situations occurred suddenly and the family members are to make decision while the heart is still beating. If there is anyone from family members who does not know what the brain death is, he or she will decline organ donation because of the first glimpse hope of the victim may wake up from the brain death in one day. Therefore, family refusal was the most common cause of donation failure in Korea. The KODA annual report also showed a family consent rate of 33%, which brings a huge drop in the consent rate. This is why public awareness is critical for reaching self-sufficiency. To enhance public awareness, the Korean Society of Transplant has established the Vital Link and has been performing various activities with other NGOs and the government, especially during the second week of September, which was dedicated to the National Life Sharing Week. However, the organ donor card registration rate has been maintained only 4% among the adult population. The main reasons for refusing donor card registration shown by the population attitude survey by Centers for Disease Control and Prevention were hesitation to register with vague causes, or do not know how to register, ambient opposition, and complicated registration process. That means more than 90% of the general population heard about deceased organ donation. However, most of those people refused to donate because they do not have enough knowledge to change their attitude to organ donation. The final approval for disease organ procurement requires the consent from the family, and making this decision is possible only when everyone has positive attitude based on accurate knowledge and the awareness about the value of disease organ donation. We all agreed that this level of attitude change can only be obtained by systematic education, not by publicizing using events. And through education, we can deliver accurate knowledge and the meaning of disease organ donation not only to students but also to teachers and their families. So we developed and published the Youth Education Manual for middle and high school students, and we constructed on an offline-based organ donation teaching aid libraries using diverse approaches such as YouTube VitalLink Academy channel. And high and middle school education program was implemented with great success. As a result, we could receive feedback responses from many students describing life sharing. I wanted to do it once before I die. I discovered that organ donation could save many people. We also developed a pre- and medical school education program. This program will be applied to the first grade pre-medical and medical student classes after finishing a pilot test at the Seoul National University. The mission of constructing the National Transplantation Registry is based on its usefulness for understanding the status and the trend in transplantation, detecting risk factors that have a negative impact, and promoting research. With the help of global leader registries, we established the Korean Organ Transplantation Registry, Curie. And the Curie provides a basis for another transplantation database, the Asian Society of Transplantation Registry, ASTRAC. The ASTRAC consists of 3 different database platforms: ASTRAC-N for national data, ASTRAC-H for hospitals, and a platform for linking databases for pre-existing national registries. It also provides platforms on demand with on-site data visualization, as you see in this slide. I would like to take this opportunity to invite you to join ASTRAC to work together for evidence-based clinical science in organ transplantation in Asia. Through this process, Korea have secured the following functions or organizations for disease organ donation and transplantation. Those are KONUS, the national agency, KODA, independent organ procurement organization, mandatory reporting system, the VitalLink for enhancing public awareness, and Curie, the national transplantation database. And the last component, I would like to suggest an official structure for coordination and policy making in organ transplantation. Since disease organ transplantation is a comprehensive cutting-edge clinical program that requires the multidisciplinary collaboration of many clinical and socio-economic fields, it is necessary to gather the opinion of all involved in reaching a consensus and to set a policy for many challenging issues in organ transplantation. For example, if the country cannot provide universal coverage for disease organ donation, who will pay will be one of the most important issues. If the country has no system for an indirect payment, donors and recipients will be exposed to the risk of transplantation commercialism and to economic inequity. In response, our region in India made a policy to secure social funds for organ transplants. Likewise, there must be a policy-making body for many other issues for disease organ transplantation. In summary, under the basis of WHO requirements, which was provided during the third global consultation on organ transplantation of Madrid 2010, Korean government and hospital structures and organizations were established with modification of adding two fields, public awareness and coordination and policy fields. As a result, number of actual disease donors increased markedly with decreasing number of overseas transplantation cases in China. On the other hand, this heat map plot shows a huge gap in the performance capacity in organ transplantation between Asian countries, and organ transplantation activities in Asia are heavily focused on living donate kidney transplantation. Even Korea is ranked very high in top in Asia. The PMP number of actual deceased donors remained very low when compared with Western countries. Therefore, there are huge areas for improvement to save lives of our patients by organ transplantation in Asia. I would be grateful if Vietnam could join us in this very important Asian organ transplantation capacity building project to work together in goodwill until we, all Asian countries, reach self-sufficiency in organ transplantation. Thank you again for giving me this opportunity. Thank you very much.